And good afternoon to everyone, and welcome to the April HBCU Learning Collaborative. On behalf of the leadership and staff at the Center to Champion Nursing in America, thank you for taking time to join us today for this important presentation. I would like to introduce today's presentation from the Future of Nursing Campaign for Action and bring to you today's webinar focused on the Black Commissioned Officers Advisory Group in the United States Public Health Service Commission Corps. I want to mention that we are recording today's webinar. If you happen to miss a section or you would like to share the proceedings with one of your colleagues, you can find the recording by going to www.campaignforaction.org/webinar. I now have the privilege of introducing today's presentation and presenters. I will not read their full biographies, but they are available and will be available on the website along with today's recording. Our first presenter to get us started will be Lieutenant Commander Nuri Tapwa, who is a pharmacist in the United States Public Health Service Commission Corps. He serves as the Recruitment, Readiness, and Retention Lead for the Black Commissioned Officers Advisory Group. Joining in the presentation is Lieutenant Commander Stephen Rush, who is a Personnel Management Team Lead with the Department of Defense Health Agency and a recruitment partner for the Black Commissioned Officers Advisory Group. And rounding out the presenters today will be Lieutenant Commander Barbara Mason, who is a recruitment specialist and team lead with the Commission Corps headquarters of USPHS. And with that, I will now turn today's presentation over to Lieutenant Commander Nuri Tapwa. Take it away, please, sir.
So yes, my name is Lieutenant Commander Nuri Tawab. I'm a pharmacist with the United States Public Health Service. I'm also the subcommittee chair for the Black Commissioned Corps Advisory Group, Retention, Recruitment, and Readiness Team. And we're here to talk to you today about nursing opportunities and other opportunities with the United States Public Health Service Commission Corps. We're also going to give you a lot of information about our junior and senior COSTEP externship programs that students at different colleges around the country, whether they're undergrad, graduate, or PhD programs, as far as the junior COSTEPs may be involved. And we'll also talk about the senior COSTEP program for graduate students. As my officers continue on with the presentation, they'll introduce themselves as well. And we'll move on to the second slide.
Hi, good afternoon. Thank you for inviting us to your platform. My name is Lieutenant Commander Barbara Mason, and I'm the only nurse in this group of officers that are representing BCOG this afternoon. So I want to go ahead and just provide an introduction to the United States Public Health Service. We were established in 1889. And we are the only agency solely committed with protecting the public's health. We actually fall under the U.S. Department of Health and Human Services, and we're overseen by the Assistant Secretary of Health. So that means that the U.S. Surgeon General and the Deputy Surgeon General provide operational guidance for us in command. So basically, as of now, as you see all of the missions in regards to where officers are deployed, COVID missions, and also the unaccompanied minor missions, officers are being deployed at the direction of the Surgeon General and also the ASH. Next slide, please. So this just a brief history about who we are and what we do and how we were enacted. So in 1798, there was an act for the relief of sick and disabled seamen. So basically, PHS officers there was an act, and PHS officers were directed to solely care for the sick and disabled seamen. And then as the years passed, and as you can see in 1870, we were commissioned to go ahead and help the Marine Hospital Service. And then in 1878, the National Quarantine Act. In 1912, the Public Health Service name was officially changed and our services were broadened. In 1998, in 1999, that was really when we had our first big mission where we were tasked to go ahead and deal with the Kosovo refugees. I cannot see. There we go. Next slide, please. So who are we? We are a force of over 6,000 public health professionals dedicated to addressing public health and providing clinical care. So we are one of the 8 uniformed services. So in addition to our sister services, Navy, Marine, Army, Air Force, National Guard, we serve in our own capacity in which we only and solely protect the America's health. So again, we're one of the 8 uniform services. So a lot of times when people see us outside of this uniform, they mistake us for Navy, which we aren't. Next slide. So what are our core values? Our core values are simple in our mission: protect, promote, and advance the health and safety of our nation. So we do that in 4 different ways. Through leadership, we provide a vision and purpose to the public for the public's health to inspire and dedicate, and it includes loyalty, excellence. So basically, with recruitment, we recruit the best and we want the best so that when our officers go out and perform and represent the Corps, you know that you're getting the best that the Corps has to offer. We provide service where we are committed to the service and public health through the compassionate actions and stewardship of time, resources, and talents, and integrity. So we're providing ethical care that falls in line with the highest standards and responsibility and accountability. Next slide, please. So what do? We do a number of things, and as you see, we all fall in different categories, but my 2 other officers, they actually perform very different roles. And I think Lieutenant Commander Tawab is the only one that performs a pharmacy function, but as myself and Lieutenant Commander Rush, we function as a more admin. So what do? We provide essential health services. So we provide care to vulnerable and underserved populations. We serve on the front lines of public health emergencies, which has been demonstrated during COVID and also in the past years, hurricane and natural disasters. We lead public health programs and policy development. So we're utilizing the experience, skills, and networks that we have to provide leadership within the U.S. Department of Health and Human Services and our stakeholders and counterparts in which we serve. And then we also advance innovation. We work at the forefront of medical challenges like COVID, cancer, and the opioid crisis. Next slide.
Hey, good morning, everyone. It's Lieutenant Commander Rush, and I'm going to pick up right here again. I'm a pharmacist as well. And just to piggyback on some of what Lieutenant Commander Mason said, she highlighted overall exactly what public health is. A lot of people get confused when you hear the term public health. It's like, well, what is it? And it's actually a lot of different things. So I always try to make sure I touch on that to try to expound on it a little bit, to make it make a little bit more sense, because within public health, you got so many different dynamics. You have clinical aspects, where you have, like your traditional doctors and pharmacists and nurses and physician assistants and things of that sort. But then you also have someone who has to pay for it. So you got insurance components. So things like TRICARE, as well as Center for Medicare and Medicaid Services, or agencies like that, who kind of oversee that aspect. I think all of us have heard of like fraud that takes place when we see the articles on the news, especially as it pertains to Medicare and Medicaid. Then you have more traditional public health, which is kind of like the epidemiological surveillance and things of that sort, which is done at the CDC a lot of times. And I'll touch on this in a few other slides, but I just kind of like to highlight it. You got a regulatory aspect where Lieutenant Commander Tawab works with the FDA. So they oversee a lot of drugs, and not just drugs, but also drug devices like insulin pumps. And when you go to run an IV and that machine that works, that's a public health device that has to be approved for safety, for efficacy, to make sure that when those nurses and physicians go to use it, that it actually works and does what it's supposed to do. You've got various policy-driven aspects of public health, as well as like some of the more emergency preparedness and things of that sort. So I just wanted to kind of highlight that a little bit, which also ties right into that career diversity, which you see there on this slide. And you have the ability to create your own path through public health, which makes it kind of unique. I always like to share kind of my journey thus far. I've been in the public health service for almost 4 years now. My first duty station was more as a clinical pharmacist with ICE Health Service Corps. And so I worked as a chief pharmacist and kind of like in a health services administrator or hospital administrative type of role, where I function more as a clinician and as a true pharmacist would, like what you see in a hospital-like setting. From there, I actually worked as an investigator at the FDA next. So not quite traditional pharmacy, but on that regulatory side to make sure that the drugs that you get in that bottle when you go to the pharmacy is what it says it's going to be. It's going to be safe. It's going to be effective. It's not going to harm you and things of that sort. And then now I'm more in a program management, personnel management / project management type of role, which is a little more administrative in nature. But again, it's very important to make sure you're putting the right people in the right places. So like what I do now at DOD is a lot of hiring and administrative like work to where I try to make sure that any of these MTFs that are supporting our service members and their families have the right personnel in place. So I don't just oversee the pharmacists, but also a lot of the doctors, the nurses, the dental hygienists, the social workers, all sorts of type of things. So you get a broad diversity all in one job, essentially as a public health officer. You also have a lot of professional development that takes place. We're highly encouraged, and we even get access to the GI Bill, which Lieutenant Commander Tawal will talk about later with some of the benefits. But that's just for you to continue your education, continue to learn, and get certified in different things like vaccination. Anything else that you may work in, like Lieutenant Commander Tawab is at FDA. A big certification there is the Regulatory Affairs certification, or the RAC, as you hear people talk about. And so you're just strongly encouraged to continue to develop yourself professionally as a leader and things of that sort. Also with the work-life balance, it's outstanding work-life balance. I go to work every day at 7, I get off by 3:30, and I love it. You know, when you're in some more traditional clinical roles, I know like a retail pharmacist at Walgreens or CVS, for example, those guys are working 12, 14 hours a day sometimes. And I feel bad for them, but I get my weekends and holidays and typical 8-hour day, and I go about my business. So I love it. You get 30 days of vacation per year. You can also roll over 30. So you can go into any given year with about 60 days, a little over 2 months of vacation time, which is unheard of. There are several financial advantages as well, such as non-taxable housing. So when we get our checks, for example, we have a base pay that does get taxed. Based on what your rank is. Again, like Lieutenant Commander Mason said, we are a military or uniform service rather. So we get paid on that same pay scale. And then we also get a lot of untaxed pay. So like based on the zip code of where your duty station is, you'll get an untaxed pay of whatever that may be for that particular area. You also get a food allowance or a subsistence allowance, which is a little over $250 a month. That's also tax-free, as well as other various perks depending on what your specialty is. And things of that sort. Like I'm a pharmacist, so I get specialty pay. There's certain aspects of nursing that'll get the same and things of that sort. And as far as our retirement plan, we use the Thrift Savings Plan, or TSP, which is kind of like a 401k, if you will. We also have our life insurance and survivor benefits being active duty as well. Next slide, please. So what I like to talk about here is a little bit more on that career diversity that we were talking about. So when you see, we are part of Department of Health and Human Services, but we have agencies that also are non-HHS. HHS meaning Department of Health and Human Services. That's the H, the H, and the S. So again, we have about 6,000 officers in a ton of locations. We're all over the country. We got a select few amount of officers that may be found international from time to time, but for the most part, we are domestic. And so what happens at some of these agencies like CDC that you see there is that's a lot of that public health, epidemiological, the data, the surveillance studies that we talked about. CMS is Center for Medicare and Medicaid Services. I never understood why they didn't put a second M there, but that's what CMS stands for. Then you have the FDA, which is Food and Drug Administration, which is a regulatory organization. HRSA, which is Health Resources and Services Administration. A lot of people aren't too familiar with that one. What they do there is they have a lot of money that comes in the form of like grants and things of that sort to help underserved populations. So a lot of free clinics that you hear about, a lot of officers are working at HRSA to make those clinics exist. Some even work in those type of clinics. So it just, it's just another way to serve a lot of the underserved communities. IHS, which is Indian Health Service, Lieutenant Commander Tawal will talk a little bit about that later. He actually used to work there. NIH, which is National Institutes of Health. So any kind of research or investigational like drugs that go on, they take care of. SAMHSA is more of a policy-driven organization. It's Substance Abuse and Mental Health Services Administration. Department of Defense, which is where I work, we do all kinds of stuff. So you got a lot of project management roles. You've got a lot of clinicians that work at various MTFs or military installations across the country that have like their hospitals on base. You've got Department of Homeland Security, which is where such an organization like ICE falls under. I used to work for ICE, like what I mentioned before, and they've got a ton of things that are going on there. Same for U.S. Agency of International Development. The Federal Bureau of Prisons, that's another agency where they do a lot of clinical-like work, clinical-like settings, as well as various other state governments and local agencies. So again, it just speaks to the career diversity that you have in a position like being a public health service officer. Next slide, please. And so here, this just, again, we're going to focus today more on the nursing aspect, but these are the 11 professional categories that we have. And you just kind of can see the diversity of a lot of the officers, like Lieutenant Commander Tawab and myself are pharmacists. Lieutenant Commander Mason is a nurse, but we also have medical doctors, dentists, veterinarians, therapists, dietitians, health service officers. Health service officers is kind of a catch-all. It's got quite a bit in there. It's got everything from licensed clinical social workers to physician assistants, to IT-like officers, because again, with a lot of these things, you have various IT systems that you need, such as an electronic health record and things of that sort. So we got various IT officers as well as engineers who help with a lot of the structural things that go on within a healthcare setting, who are very necessary. We also have environmental health officers as well as scientists, which is kind of another catch-all. There's quite a bit of PhDs that work within the PHS. Next slide, please.
So the focus today more so is on the nursing. So as a nurse, I want to say my career has been very rewarding. I've had the opportunity to basically diversify and experience a lot of things. One thing that is so special and unique about the United States Public Health Service, I'm sure I failed to mention it before, is that unlike the other services, they are told where to go. They are directed where to go. They get options, but at the end of the day, that service, whether it be Navy, Army, Air Force, drives where that officer goes and works. United States Public Health Service is so unique in that the officers have the opportunity to pick and choose where they would like to work, what agency they would like to work. So, we would apply in to those agencies directly, either or through USA Jobs. So nurses work in a very variety of roles across the government to provide clinical care, develop health policies, perform research, and lead public health programs. As you're aware, before our 41st Surgeon General was actually sworn in, our acting Surgeon General, Admiral Sega, who is a nurse, was acting as a Surgeon General. So nurses play a vital role. I would, even go as far as to say we are the backbone of PHS. But, that's just me being having some bias towards my category. But we participate and touch almost every agency, and we work in a collaborative setting. So we translate evidence-based research, and that happens a lot within NIH and CDC. So we work well with a lot of the agencies, and we contribute to the health and wellness of individuals and communities throughout the nation. In my career, I started out as I worked for the Bureau of Prisons, and then it was mostly clinical. Then a couple of years, probably like 7 years later, I graduated and transitioned on to work at the Walter Reed National Military Medical Center, where I was the clinical manager for the Wounded Warrior Clinic. And that allowed me to have the diversity, the career diversity and the experience to also manage and also do clinical, and then also serve our other active duty service members and sisters and brothers. And then now me being at headquarters in recruitment, it actually provides me an added layer to, I guess, my career portfolio, should I say, or my career diversity, and that I'm doing something else with what I've gained, all the tools that I've gained from all the jobs and experiences that I've had. But I'm still a nurse. At the end of the day, I'm still a nurse. So what the other lieutenant commanders have failed to say is that even though we have our categories as pharmacists and nurse, or you have other categories who have clinical skills, whether it be a doctor or PA, we may have other roles where it be policy writing, grant writing. We still at the core need to maintain our basic skills, or our qualifying category, qualifying skills, which are whether it be nursing, pharmacy, those basic skills. So even though we may have roles in clinics or admin, we still need to be able to perform when we are deployed out in for emergencies and performing those roles. Next slide.
Greetings, everyone. This is Lieutenant Commander Tawab, and coming back, I want to speak to you information about our readiness and deployment. So actually it's interesting. So the Office of the Surgeon General through the Commission Corps headquarters is responsible for the coordination of readiness and deployment. These can be domestic or international operations. A few years back, we had different deployments in Africa for Ebola crisis. We also have like deployment teams. They used to be structured around those who can be deployed within a few hours to a few days. Every year we're upgrading and improving our deployment process. We also do humanitarian missions. There's officers like pharmacists and nurses who work with the Navy and board ships, and they go out throughout South America and other parts of the United States and provide healthcare around the country. We do a lot with disaster relief as well. A lot of hurricanes like Hurricane Irma, a large Hurricane Katrina, many different hurricanes where you may see uniform officer down there at certain hurricane disaster sites. You may think, oh, it's maybe Navy, maybe it's Army, but a lot of times it's us. It's us, the United States Public Health Service. We also work with emergency responses. We actually have a team that works in DC where any issues go on in the local area that we assist with that. And we do global training as well. Deployments, there are opportunity to show our skills as public health service officers, not only to the country, but to the world. Here's some pictures of officers who've been deployed in the last year for the COVID-19. Actually, my first deployment was last year, and I was deployed to California around January of last year in the beginning of the pandemic, where I awaited and took care of US citizens who were actually coming from Wuhan, China. So it was a great experience working with the CDC. Also got deployed again last year to North Carolina, where I did contact tracing for individuals who may tested positive for COVID. And we wanted to find out, where they possibly contacted the virus. And also we looked at who individuals they may have been around and to assist with controlling the spread of the virus. And actually interesting, 2 hours before this, I just found out I'll be deployed again to assist with the COVID-19 and vaccination. So wish me luck. And but this is things that we do, we're proud to do as Corps officers. This is what we signed up for. And it's great because the job is always changing. It's never boring. And this is in addition to my job at the FDA, the Food and Drug Administration. So here's some information. Say, join our noble effort. The United States Public Health Service Commission Corps offers rewarding careers for public health professionals who desire to protect and promote our nation's health and treat those most in need. We are recruiting service-driven clinicians and public health professionals in 11 professional categories, including physicians, nurses, dentists, veterinarians. So they're mentioning different things. Let's start off with career growth. Professional development, as Lieutenant Commander Rush spoken, there's leadership training, mission, mentorships, continuing education credits, GI Bill. All these are opportunities that are afforded to PHS officers. But in addition to that, these are also similar opportunities that we afford to those who are joining our COSTEP program. We have a commissioned officer externship program. These are like internships that officers can do. We have a first one called a junior COSTEP. And the junior COSTEP officers can work under other PHS officers at different locations for around 30 to 120 days. But it's 30 days minimum. But in that time, you receive healthcare benefits and other benefits that PHS officers receive, and you actually get commission. And that commission time is, although it's decommissioned at the end of your internship, but that time can be recommissioned if you join the Corps after graduation. And the pay is excellent. I mean, I say excellent paid internship for students. I mean, just as a pharmacist, this was the year 2011, and I did my junior COSTEP internship in the Pueblo Indian Reservation in New Mexico. And on the monthly pay, I was receiving nearly $4,000. And that was just as a student doing a summer internship for 3 months. After the internship, I knew the career in the Commissioned Corps is what I wanted to take upon. And so by the time I got to my third year, I applied to be a senior COSTEP. And in this program, you make a commitment to the Commissioned Corps to work for the Corps upon your graduation. And so I was accepted into the senior COSTEP program. And so my last year of pharmacy school, I was actually getting paid as an 01 ensign officer, which is similar pay that I was getting a couple years before as a junior COSTEP, because they both are 01 rank. 01 as an ensign. Right now I'm at 04, which is lieutenant commander. But you're getting paid at least as an 01 your last year of school when you're in a senior COSTEP program. And upon graduation, I was able to start my career on a Navajo Indian reservation in Kayenta, Arizona. It's about 5 hours from Phoenix, 3 hours from Flagstaff. It was a really remote location. The nearest airport was 5 hours. Nearest grocery store was 3 hours. But in that, it was like being in another country while still in America. I got to learn all about the Navajo culture. I got to learn about different food. I got to go to powwows. I got to network with people that I still speak to today. Even if I go out to the reservation or Indian reservation now, there's people I can know and stay with and talk with because I had a really great experience there. And the thing about working on a reservation there, as a pharmacist and see as a nurse, there's so many opportunities you can do. In addition to working as a pharmacist at the clinic, I taught at the local high school, volunteering, teaching pharmacy math to the different students. We had a childhood obesity program where I worked with the pediatrician. So there's so many things you can do at these different agencies as a Corps officer. And the pay, the pay is really competitive. He's just speaking as a pharmacist. When I started off, it was slightly less than my my pharmacist friends who worked in retail or worked in public sector like a Walgreens or things like that. But now, my salary from when I joined the Corps, and it's been about 8 years, it's actually doubled, and I make a lot more than my friends who chose the non-government route. And excellent, as Lieutenant Commander Rush spoke about the housing allowance. It's a tax-free housing that we get as part of our paycheck based on the location that we are in the country. And the amount of money that they give us for the housing allowance, it's way more than my rent or mortgage would ever be. And in addition to, we got the student loan repayment program. If you've been in the Corps for at least 10 years, all officers can get their loans repaid. But if you're working at certain sites like the Indian Health Service, they have student loan repayment programs where they actually pay for your loans while you're in school. We touched on 30 days of paid vacation. There's paternity leave. and maternity leave, both of those, and you get paid federal holidays. It's just so many benefits being a Commissioned Corps officer, and even as a student program that I hope anyone listening to this really get to take advantage of. So again, going over some of the benefits, so like we said, we offer benefits on GI Bill, retirement. As far as retirement, we have what's called the blended retirement. And in this retirement plan, and my other officers, you can correct me if I say anything that needs to be further addressed. But if you, everyone after 20 years gets a retirement, and with the blended retirement, you put in 5% towards your retirement. And after you retire, you will get 40% of your base pay for the rest of your life. And that's the benefit of our retirement program. So you're getting a pension. Many jobs today, I mean, it's rare that you find a job that still offers a pension. And that's a great thing. And also you get the GI Bill. If you've been in the Commissioned Corps for 3 to 4 years, you can actually get your college education paid for. I went back to school and got my master's in public health after I graduated from my doctorate of pharmacy program. I could have had a Corps paid for, but I decided to keep it and pass it on to my children one day. There's potential ability to transfer from civil service to uniform services. There are requirements to be into the Commissioned Corps. There are health and weight requirements. There are age requirements, and even staying in the Corps. You know, we're public health service officers, so they want to make sure that, you know, we're presenting that. So we do have fitness tests that we take, health weight standards that we must meet, and also physical exams that we must pass each year. And we also have a uniform that we must, you know, wear correctly. But these are all things about being an officer. Recently, we actually started the Ready Reserve Corps. So this is for officers who may not want to join and be an active duty full-time officer. They can actually join as a Ready Reserve officer. They receive, there's information about different benefits that they receive. You won't be on the same retirement track, but you will get a pension for your time served. But you get also specialize helping out the Commissioned Corps with different global health emergencies, regional and national emergencies. You get to preserve your clinical care position by maintaining a surge capacity of health professionals available to deploy without jeopardizing the service of clinicians in hard to fill roles. So for instance, there's officers maybe needed Indian Health Service who get deployed. As Ready Reserve, you can fill in on that portion. Again, the goal is that if you can't be in a Commissioned Corps full time, but you still want to serve your country, you can do that in a Ready Reserve, as a Ready Reserve officer in the Commissioned Corps.
Hey everybody, it's Lieutenant Commander Stephen Rush again. Here's what we're going to talk about, what we do in the Black Commissioned Officers Advisory Group, also known as BCOG. So a lot of us are very passionate about still promoting each other as a race within the Commissioned Corps. And we actually established something this year called the HBCU Initiative, because what we started realizing was there's a lot of underrepresentation of people who look like us in the Commissioned Corps. And it's largely because a lot of our schools just don't even know we exist. And so that was a big reason why we wanted to come and do the presentation today, and we appreciate your time. What I like to show on this picture in particular is you kind of see the service dress uniform, the one in the black suit, as well as that khaki uniform. And so those are two other uniforms that we often wear in addition to our ODU uniforms that we have on right now. Next slide, please. So some of the things we do and within BCOG is we try to bring up interests and concerns of Black officers. So any racial disparities that we may think is going on within the Corps, addressing things like vaccine hesitancy this year amongst a lot of our communities and things of that sort. We also support the Surgeon General on various initiatives that he or she may have. For example, opioids and addiction is always a big one and one that's been tackled quite often. Same with tobacco cessation and trying to get people to stop smoking because all the non-beneficial health things that can go on by smoking. Another big one right now, obviously, is COVID-19 and keeping up with that information and how it pertains to our communities and trying to address any health disparities. Again, I mentioned that we do serve a lot of underserved populations, which oftentimes is us as well as other minorities. And so we just try to make sure that we're properly represented. And we do have other chartered minority groups as well, which is listed at the bottom They have an Asian and Pacific Islander, one Hispanic, as well as American Indian and Alaska Native. So a lot of groups within the core, but again, we're just focusing on BCOG today just to make sure we get that representation out. Next slide, please. So when you do get involved in BCOG, some of the things that you may get involved with is like career and professional development, mentoring, recruiting, retention, and readiness. Recruiting is the committee that we're on right now that we're coming to present to you on today. Various networking opportunities amongst officers. Like the three of us on the call today, we've been in communication quite a bit, but none of us has actually met in person yet. You know what I mean? But we've all established great officership, great fraternities of each other, and just kind of get a chance to get to know each other. We give each other a hard time about the schools we went to. I know I went to the best one in North Carolina, A&T. Lieutenant Commander Mason went to my rival school, North Carolina Central. And Lieutenant Commander Tawab went to this small school out in Virginia Beach called Hampton University. But we always have a good time, but it's all love. We enjoy each other. We enjoy going to each other's schools to do presentations like this. So we're definitely thankful that you guys chose to have us come in today. Like Lieutenant Commander Tawab say, some of the community missions that we do, we call them hometown missions. One of the more popular ones, especially after Hurricane Katrina, was the NOLA mission, or the New Orleans, Louisiana mission, where we'll go down and we'll typically do a recruitment event, a community service event, as well as just spread the news and the knowledge about the Commission Corps and some of the opportunities that are afforded to people who choose to join such a thing. So we've done everything from kindergarten to 12th grade STEM programs, presenting to folks like you all, various colleges and universities, even some international work. And, you know, we also explain the Surgeon General's initiative, because a good way to understand who we are is a lot of people understand that the Surgeon General wears a uniform, but they never really associated him with a branch of service. Well, now you all know who that branch of service is and us. And so, again, we just thank you for the opportunity to come in. You can go to the next slide. It has our contact information on there. And we just definitely want to thank you guys for the opportunity to come and talk to you all. Hopefully you got to learn a little bit today about the various opportunities and things within the U.S. Public Health Service that are afforded to a wide variety of categories and things of that sort. And if any of my colleagues want to chime in and add anything, feel free.
Yeah, this is Lieutenant Commander Tawab. I just a correction on my email. It's nori.tawab@fda.hhs. So if anybody write that down, that's my old email, IHS, but the new one is fda.hhs.gov. So if you got any questions or concerns about pharmacists or the externship programs, I'll be gladly answering questions.
And yeah, so I particularly work in recruitment and actually commission new officers. So the CAD question email that was posted is actually the best email to have interested parties. Oh, they didn't put it up there, but we can I can put it in the mailbox or I can forward it. But it's how you can also contact USPHS Recruitment directly if you have any recruitment questions. I just wanted to thank everyone for the opportunity to present. One of the things that recruitment is doing, and me and my team of recruitment specialists should be reaching out within the next 30 days to some of the universities that we speak to, that we recruit to. We'll be sending out recruitment packages and engagement packages so that we can have a more focused presentation one-on-one with your nursing students and your nursing programs. And as long as they fall under our accreditation standards, we'll be reaching out to you. So it'll be separated by region. So within the next 30 days and next 30 to 60 days, things are slowed down because of the deployments that we have going on. So a lot of officers are being deployed right now. But once everything comes back to normal or semi-normal, the new normal, should I say, the recruitment and assignments branch should be reaching out to your universities and schools so that we could actually engage with the schools one-on-one in their programs where we can recruit officers directly. So those who are in their senior year, and then also assist undecided students about having a clear pathway should they find something in our presentations that sparks their interest. Thank you.
Thank you so very much, Commanders Tawab, Rush, and Mason. You've provided a lot of informative information. I think many of us were not aware of the opportunities that exist with the Public Health Service Corps, the opportunities for professional growth, as well as the opportunities for economic benefits. So I think that it offers a really great opportunity for students in our various nursing programs. So we have about 10 minutes for Q&A. I'm going to ask all participants, if you would like to ask a question, you are able to either just drop it into the chat, and we're watching the chat, or if you want to just unmute yourself and speak up, please feel free to do that as well. There was one question in the chat. Someone wanted to know if you would be able to share your PowerPoint presentation with this group.
Yes, we'll be able to share it. I'm actually going to make a quick correction to Lieutenant Commander Tawwab's email address, and
Okay.
so I can include that, and I'll send it as a 3-page PDF. So
All
I'll send
right.
it to Jasmine, and then she can disseminate it, I guess, to whoever needs it. Okay.
Yeah, that would be very good. Everyone was interested in the slides. We have another question, and that is, what is the age range for active and/or reserve service?
I can take that question. So for general duty or active duty, the age limit is 44. For reserve, the age limit is 40. PHS offers age waivers, but it depends on the category. So right now we aren't considering age waivers for the nursing category, as that category, we don't have a problem recruiting nurses. But for the other categories like medical, dental, and veterinarians, we do have issues with recruiting, not issues, but it's just the recruitment levels are low. So those categories are the categories where we're actually giving age waivers for individuals who are above the age of 44 for our general duty and 40 for ready reserve.
Thank you so very much. Another question has come in regarding the internship program. I know that Commander Nuri Tawwab spoke about the internship program where he participated when he was still enrolled in his program. So can you share a little bit more about those opportunities, especially for our nursing students?
Yes, the opportunities for the junior and senior COSTEP program, they're geared specifically, especially, let's start off with the junior COSTEP program. This one is not really a commitment, it's more of just an internship that you may do at any agency. So you can possibly do that at FDA, CDC, NIH, NOAA, different agencies where nurses, most likely where nurses are working currently. And when you apply, they ask you, where would you like to do your junior COSTEP, internship at. But now, as far as the senior COSTEP, this is a really strong recruitment program. So the areas that they want you to actually commit to are areas of need that we have a difficulty recruiting for. So that's usually like the Indian Health Service, ICE for immigration, and the Bureau of Prisons. And we have pharmacists and nurses, I should say, officers that work at these different locations. But we're trying to increase those areas because those are areas of need. But you go there, you build your career. As Lieutenant Commander Barbara said, you're not always told what to go. But if you do the senior COSTEP, you are to remain at that location for twice the amount of time you're paid. So if you got paid for 8 months in your last year of nursing school, then you are obligated to serve that duty station under this contract for at least 16 months. But all officers must remain at their duty station for at least 2 years. But again, it's great pay and great opportunity to get into the Corps early. And that time goes towards your pension, and in addition to when you become an actual officer.
Okay, thank you so very much for explaining the internship programs for us. Another question for you, Lieutenant Commander Mason. Would you recommend a new graduate nurse pursue a career with the United States Public Health Corps after graduating, or should that nurse pursue a year or two of experience first? You're muted, you muted. Thank you.
Thank you, ma'am. I am a proponent. I had the opportunity to join the Corps upon graduation, I would, because it's not, you can grow as an officer within the agency, and you can grow as a nurse. You can grow as a nurse within the agency and grow as an officer within the United States Public Health Service. So it's actually twofold. So what is different about the United States Public Health Service? You have an officer track and you have your job that you do, so your career track. So you have to meet the guidelines to make sure you're meeting the benchmarks to maintain your officership, but you still have to be able to perform as, whatever category, and me being nursing, and Lieutenant Commanders Rush and Tawab being pharmacists. So I recommend anyone, as Lieutenant Commander Tawab stated, he came in the junior COSTEP, senior COSTEP, and then he subsequently gained his full commissioning after he completed his commitment to Indian Health Service. So I say yes, come in as a new officer, as a new grad, because you will get the experience in, because I know for the Federal Bureau of Prisons, I came there as a new grad, and they have programs set up like orientation to take you through, so you can safely practice and get your confidence up. Because I know, looking back as a new nurse, I didn't have the confidence leaving nursing school. But as I experienced and I operated under my own license, but as I had the guidance and the mentorship of fellow nurses who were, didn't mind teaching me and hand holding me with some policies and thought processes that I hadn't had experiences with in in college or during nursing school, it actually helped me helped me build my confidence, and then also helped me build, my leadership skills. It helped me decide, hey, this is the career path that I wanted to do, and actually this is for me. Um, some agencies aren't for everyone, and you can, after you do your commitment, you can go, and then, it's all in the experience. And I always move from a learning experience. So I take whatever experience that I have as a lesson. So what is this experience trying to teach me? And so when someone moves in that direction or in that pathway, they always are learning from experience. So yes, I say new grads, bring it on. We take them. We will, as long as all your paperwork is in order, we will commission you. Yes, we will.
And to add on to that, I just wanted to just state new grads, getting into the Corps, it's so many great things you can do. Like when I was in Indian Health Service, there was nurses who would ride on a helicopter with other care providers into the mountains, because some of the natives actually lived up in the mountains. So this is the type of things you were doing as a nursing. We were working late. We would have emergency rooms. We would work at Indian facilities at a really remote area. Another cool thing I always tell people, when I lived in Monument Valley, and I didn't know at the time when I got there that this is where John Wayne shot all his cowboy movies.
Mm.
It's actually a movie Hollywood, still a Hollywood set. Musicians like Kanye West and Taylor Swift, they were actually shooting music videos out there throughout the summer. I saw the movie Transformers with the cars and everything being made. And so you think, okay, I'm in the middle of nowhere on Indian reservation. I was actually on a Hollywood set. And so this was like 5 minutes from my house. And, I got to drive to the Grand Canyon. It was only 2 hours away. In the Indian Health Service, I had every weekend off. So Friday nights, we would go drive out to Las Vegas. It was only 4 hours. I lived out west. I would drive out to California, Hollywood. So all these great things, experience you got, being on at these different agencies. And, my friends who get stationed in New York, I have a friend that lives in Miami. She's a nurse, and she works with the cruise ships, and people coming off the cruise ships, she's checking their healthcare and things like that. So it's so many, just so many cool things you can do. It's nurses that work for the FDA, and they're in India and in other countries working, inspecting different drug companies. making sure that, medications that are being trying to get approved in this country, they're verifying and checking those things. But it's just so many things you can do as a nurse and as a corps officer.
Wow, that's amazing. Commander Rush, did you have a comment to add before we close down?
Yeah, absolutely. I was gonna just piggyback on exactly what both of them said. When you ask a question like that, it's very loaded, and we get excited about as officers to answer those questions. So yeah, if it's any new nurse, anyone who I would say is self-motivated and has a curiosity for just learning more about what they can do with their profession, the Corps is for you. It can be as clinical as you liked it. Like I mentioned a lot of the career diversity earlier. It can be as clinical as you'd like it. So if you want to go from a staff nurse to a chief nurse to a director of nursing, to overseeing nurses regionally and nationally, then you can do that. But also, let's say you're a nurse and then you get deployed for emergency response disaster. You may find a new passion for helping people in those aspects that are really unfortunate and dealing with things of that sort. So you may want to go work for an organization or agency like a FEMA or like an ASPR who is in control of handling things of that sort. You may have an issue with how the healthcare system runs overall, so an agency like AHRQ may be beneficial to you. I say all that to say that's what's so special and unique about public health is whatever your interests kind of take you towards, you can find a career there. You just have to do your research. Obviously, I've done quite a bit being in the public health service. You just have to do your research on what the missions of each agency is and just kind of find your knack as you go. But what's nice about being in PHS, I don't know if any of you have ever tried to navigate USA jobs, but it can be a headache to say the least. But by being in the PHS, you have various liaisons you can reach out to. I actually work in the liaison office for the DOD. As well as just network and make connections to be able to make those transitions amongst different agencies to find your next job. Again, Lieutenant Commander Mason mentioned it that we get to look for our own jobs. We don't necessarily just get told, hey, you're going over here for the next 2 years. It doesn't quite work that way. So that's what's nice about being in the Corps, another added benefit. But I just wanted to chime in and just say, anyone who's a new grad, please feel free. Again, if you're self-motivated, you got that knack for learning, that curiosity about yourself, go for it. I'd also tell you guys again about the HBCU initiative that we're doing. Any of you that want us to come in and speak, you have our contact information. I just emailed out the slides that has all the information at the end. We'd be happy to set up a presentation with you all. It doesn't have to be just for nursing. Again, we talked about some of the other categories and things of that sort. And even if you have like feeder programs of like pre-med, they may not know if they want to go med school, dental school, pharmacy school, things of that sort. That's also an area that we can help address, and we'll do a presentation similar to what we did for you today.
Thank you so very much. And our time has come to an end with you today. I want to thank you so very much on behalf of the Center to Champion Nursing for taking time and speaking with the HBCU nurse leaders and deans and faculty. I'm sure that everyone here learned a lot of new information and opportunities that they will be able to share with their students. And I certainly hope that you are invited to one of the schools so that you might do more of a personalized presentation at one of the HBCUs. As I mentioned in the beginning, the webinar was recorded, and you will be able to find the recording on the campaign's website. A webinar summary and any other additional resources will also be posted at www.campaignforaction.org/webinars. Be sure to follow us on Twitter, join us on Facebook, and sign up for the bi-weekly campaign update. And again, thank you for joining us for a very informative April session of the HBCU Learning Collaborative. This is Bernal DeWitty signing off until next month. Thank you.